Good morning. Your Excellency, the First Lady of Malawi, Madam Professor GERTRUDE MUTHARIKA. Thank you very much for having us here. She is the First Lady of Malawi and also the long-term partner of Merck Foundation and the ambassador of Merck More Than a Mother. Thank you very much. You're also, Your Excellency, the wife of the Vice President, Honorable Minister of Health, Honorable Minister of Education, Honorable Minister of Gender, and Honorable Minister of Information and Communication. All protocol observed. Thank you for having us here. Thank you for this precious and valuable partnership with Merck Foundation. Of course, as our MC said, silence is broken. And I am, as I told you, the CEO of Merck Foundation, but I am also an African woman. I am from Egypt. I'm a pharmacist, so I have medical background. But I'd like to see myself as a storyteller, a change maker. I'd like to see myself a woman who dedicated her life and effort to empower other women, to empower youth, to add value to the society and the community. And that's why I'm very happy to be here in Malawi and join hands with Her Excellency, the First Lady of Malawi, because she is a true, a more than a mother example. She is a critical member of Merck Foundation, First Lady's initiative. And since I met her, she told me one thing. She told me, I'm happy to partner with Merck Foundation because I want to do very good things for my beautiful Malawi. And I would like only to partner with serious partners who will add value to my people and to help them real and critical and significant help and not only talk. And that's why we are here today. So let me tell you what I told her in my first meeting. And this is exactly what we are implementing starting from March, end of March this year. We are going to partner with Her Excellency, the First Lady Office and the Ministry of Health to provide for you a very valuable asset. After we heard all these challenges in the healthcare sector, we are going to provide training, specialty training, to develop a very good number of oncologists. Oncologists mean to treat cancer. So all these challenges you are facing now here or in the rest of Africa, like early diagnosis, prevention, or good management of cancer care, which can be accessible for everyone, everywhere, is going to be very much helped and accelerated by providing this training, oncology fellowship, master degree in Cairo University and in Tata Memorial Hospital in India and Malaya University in Malaysia. All types of oncology, from surgical to pediatric to gynecology to medical to pathologists, all kinds of specialties. You will have a great team of cancer care. But also, of course, after I have seen what you have today of innovation and creativity with the help of Her Excellency, the fashion show, the song, the beautiful communication, and the will and the ambition and the passion to deliver the message of no to infertility stigma, the message to empower all women to be more than just mothers, not to be more than baby making machines, to be women who adding value deserve respect, deserve appreciation, whether they can have children or not. This is our very, very much important and critical campaign, that it is very important for Africa and for African women and for African men as well, because they can lead a happy and a beautiful life. Not because we want to avoid only the psychological consequences of being blamed to be infertile, although it's not your fault, or not to avoid psychological violence, but also to avoid this type of violence you've seen in the story of Jacqueline. This is one story, but I assure you, there are many, many Jacquelines in Africa and in different communities that be blamed and criticized and punished for being or lacking to have a children, although many times, almost 50% of the times, they are not the reason of infertility, because men too are the reason of infertility. Scientifically, infertility affects men and women equally. And that's why we are raising our awareness. That's why we are going also to provide doctors with fertility specialist training to be able to help couples across Malawi, all over Malawi, to help them to manage their infertility, to prevent also the infertility for younger couples to be husbands and wives. So this is very, very important, because we want to deliver 3 messages in our campaigns. First, infertility is not a stigma, it is not a taboo. Women are more than mothers, men are more than fathers, and if you cannot have children, you are more than parents. You can actually add value to your society and community in many, many, many ways. Can be presented in your life to be proud of. Second, not only women are blamed to be infertile. As I said, it's scientifically 50% of the causes of infertility due to men. So men should support their wives. Men should join the journey of infertility treatment with their wives. Men should not abuse and criticize and curse their wives because they are a little bit late of having children. Not only men, but also sisters-in-law and mothers-in-law. They have to stop the pressure on the couples and leave them to be and leave them to manage their life together in love and respect. Third is that women and men, the causes of infertility are many causes. Can be normal hormonal reason. It can be addressed by treatment. It can also be due to untreated infectious diseases, which can be resulted from normal hygiene issue since childhood, or normal infection, simple infection, not sexual infection. Simple infection can be developed through their childhood due to lack of immunity, due to have a virus of flu or influenza can reduce the immunity in your system and cause this infertility, due to unsafe delivery, due to unsafe abortion sometimes, due to other factors. It doesn't have to be because of contraceptive pill, although contraceptive pill does not cause infertility, and this is a misconception you have to understand, but it can be also a normal cause. These causes can be prevented if diagnosed early. That's why regular checkup is very important for everyone, so to avoid being advanced fertility reason. We decided to have different interventions to raise awareness about these 3 topics. Through media, tomorrow we will have media training for all types of media, radio stations, TV, print, and online, start to sensitize the community about these 3 messages and raise awareness about infertility in general and breaking the stigma of infertility in particular. But also, we are going to launch a very important award. I have seen how talented is our fashion designers here in Malawi. So we are going to announce call for application for Merck More Than a Mother Fashion Award, where we are going to invite all fashion designers to propose their ideas how to deliver the message of no to infertility stigma and empowering infertile women through their designs like we have seen today and other ideas, so you can have the awards. And of course also Media Recognition Award, which is going to be for media after the training to see how they are going to be a storyteller, how they are going to be the voice of the voiceless. And Film Award. We are going to also invite all the people who in social media doing films with their mobiles, with their camera, whatever, to propose ideas of films, documentary, short films, drama, documentary about stigma of infertility, about infertility in Malawi. And all these awards will be announced and distributed everywhere in the media. So people from Malawi, young, talented, beautiful people from Malawi will be proposing their ideas and will be eligible for these awards. One only thing left. We talked about oncology, we talked about fertility. We also going to address diabetes. We're having a training, it's a 1-year fellowship from UK University for doctors to be diabetes experts. And this will be nationwide program. Doctors from across the provinces, across all the sectors in Malawi will be eligible to apply and to get this diabetes diploma and become diabetes experts, and they can establish their diabetes clinic. So this will improve very much access to a good care of diabetes across Malawi. Thank you very much for all of you and your patience to hear our programs and to support us. Thank you very much for my dear sister and friend, Her Excellency, the First Lady of Malawi, for her great support, generosity, hospitality, and grace. Thank you very, very much for all of you.